Almost 1 in 3 women will have their labour induced. There are lots of reasons for this. If you would like to know more about when and if induction of labour should be undertaken, ask your doctor or midwife. This video is not about when or if labour should be induced. It's about how induction of labour is undertaken. And it's a brief introduction to the Marta Research Pinc Balloon study, comparing 2 common methods of induction of labour. The Pinc Balloon study is being run in collaboration with Marta Mothers Hospitals, Australia's largest maternity service provider, and several other hospitals with the support of the Queensland and New South Wales governments. Induction of labour begins with a vaginal examination. In Australia, there are 2 main methods of preparing the cervix for labour. The first is to use prostaglandin gel or hormone gel inserted during a vaginal examination. The second is to use a balloon catheter fed through the cervix during a vaginal examination. It's a small tube with 2 small balloons which mechanically and gently stretch the cervix. Both methods are safe and effective, and both require a vaginal examination. Prostaglandin can sometimes cause contractions, so monitoring with a heart rate monitor is required. Rarely, babies may be distressed when there are many contractions, and so it's important that women stay in hospital. Contractions are less likely with a balloon catheter, and therefore monitoring is usually not required. Both are commonly used, but it is in using the balloon catheter that you may be able to go home. We're interested in knowing which method is more effective, safer, most cost-effective, and importantly, which method women prefer. That's why we're undertaking a trial. In a trial, women who wish to participate are randomised. They have an equal chance of being in either group. Through the Pinc Balloon study, we're comparing a prostaglandin induction as an inpatient with a balloon induction as an outpatient. If you'd like to be involved, then you would consent and complete some paperwork. The day before your induction, you would be randomised and we'd let you know which group you're in. Women in both groups will still come to the hospital and have a vaginal examination. During this examination, for those in the balloon group, the catheter is inserted and you may be able to go home after about half an hour. For those in the prostaglandin group, the prostaglandin is inserted and then you'll go to the ward. Women in both groups will be reviewed the following morning, and the aim is usually to try and break the waters around the baby and to start the contractions. We hope at least 2,500 women will be involved in the study, which will be the largest investigation of induction of labour ever undertaken. We're asking some very important questions. We'd love your help answering them.